welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Study shows how thalamus may cause long-term disability after stroke. A recent study from Simon Fraser University researchers has revealed how an overlooked type of indirect brain damage contributes to ongoing disability after a stroke. The paper, published in Proceedings of the National Academy of Sciences, shows how the thalamus, a sort of central networking hub that regulates functions such as language, memory, attention and movement, is affected months or years after a person has experienced a stroke, even though it was not directly damaged itself. The findings may lead to new therapies that could reduce the burden of chronic stroke, which remains one of the leading causes of disability in the world. For the study, researchers recorded the brain activity from 18 chronic stroke patients and used computer models to understand how this brain activity reflects abnormal thalamus function when compared to healthy individuals. Recommendations to ensure safe and effective use of medical AI. A new set of recommendations published in the Lancet Digital Health and NEJM AI aims to help improve the way data sets are used to build artificial intelligence health technologies and reduce the risk of potential AI bias. An international initiative called Standing Together has published recommendations as part of a research study involving more than 350 experts from 58 countries. These recommendations aim to ensure that medical AI can be safe and effective for everyone. They cover many factors which can contribute to AI bias, including encouraging medical AI to be developed using appropriate healthcare data sets that properly represent everyone in society, including minoritized groups and underserved groups. Helping anyone who publishes healthcare data sets to identify any biases or limitations in the data. Enabling those developing medical AI technologies to assess whether a dataset is suitable for their purposes. Defining how AI technologies should be tested to identify if they are biased and so work less well in certain people. Can moderate amount of wine lower risk of serious cardiovascular diseases? Drinking a small or moderate amount of wine may lower the risk of serious cardiovascular disease in people at a higher risk who are following a Mediterranean diet, according to research published in the European Heart Journal. The new research is part of a larger Spanish study investigating the effect of a Mediterranean diet on people with a higher risk of developing cardiovascular disease. All the people taking part had no cardiovascular disease at the start of the study, but they either had type 2 diabetes or they had a combination of cardiovascular disease risk factors such as smoking, high blood pressure, high cholesterol, being overweight, and or a family history of cardiovascular disease. As well as completing questionnaires about what they ate and drank, participants gave urine samples at the beginning of the study and after a year of following a Mediterranean diet. To investigate the effect of drinking wine, researchers included a total of 1232 participants. Participants were followed up for 4 to 5 years, and during that time, there were 685 cases of cardiovascular disease during the study. Improvements in education, nutrition and sanitation combat age-related declines, study finds. A new study from the Robert N. Butler Columbia Aging Center at the Mailman School of Public Health reveals significant improvements in the health of older adults in England when compared to previous generations. Rather than considering health through the presence or absence of disease, the study, published in Nature Aging, applied a new approach that examined trends in people's functioning, their cognitive, locomotor, psychological and sensory capacities. Using data from the English Longitudinal Study of Aging, the study found that older adults today experience higher levels of physical and mental functioning than previous generations did at the same age. These improvements were large, said John Beard, MBBS, PhD, Irene Diamond, Professor of Aging in Health Policy and Management in the Butler Columbia Aging Center of Columbia University Mailman School of Public Health and author of the study. For example, a 68-year-old born in 1950 had a similar capacity to a 62-year-old born a decade earlier, and those born in 1940 had better functioning than those born in 1930 or 1920. Beard noted, if we had compared someone born in 1950 with someone born in 1920, we would have likely observed even greater improvements. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.